The genus Staphylococcus has at least 35 species. The three main species of clinical importance are Staphylococcus aureus, Staphylococcus epidermidis, and Staphylococcus saprophyticus. We can differentiate all these species on the basis of Coagulase test. Staphylococcus aureus produce the enzyme Coagulase. That's why it is Coagulase positive. And the other two species of Staphylococcus species like Staphylococcus epidermidis and different type of hemolysis. The Staphylococcus aureus produce the beta hemolytic colonies onto the blood agar. So the beta hemolytic colonies produced by the Staphylococcus aureus is its differential point. We can also grow them onto the nutrient agar of the 7 to 10% NaCl. It allows the growth of Staphylococcus aureus only and inhibits others. On nutrient agars, there are the circular smooth cervix opaque and produce the golden yellow pigments. There are the different culture characteristics. These grow under the aerobic or microaerophilic conditions, ferments many carbohydrates. Staphylococcus produce the antigens like the peptoglycan. This is present into the cell wall and being responsible for rigid exoskeleton. The function of this peptidoglycan is to elicit the production of interleukin-1 endogenous pyrogens or elicits the production of opsonic antibodies. And this is the chemoattractant for polymorph has endotoxins-like activities. It can also produce a localized Schwarzman phenomena and activate the complement. The second is the teichoic acid, which is present into the cell wall linked with the peptidoglycan. The function of this antigen can cause productions of the antibodies in the patients with the active endocarditis due to the Staphylococcus aureus. Different type of the proteins like the protein A is also antigens present into the Staphylococcus aureus which binds to the Fc portion of IgG antibodies. Number 4, the capsules. Only some strains of Staphylococcus aureus have the outer capsule. The function of this is to inhibit the phagocytosis by the polymorphonuclear leukocytes. Different types of enzymes are produced in this. The number 1 is catalase, which converts the H2O2 into the water and oxygen bubbles. This differentiates the Staphylococcus from the Streptococci. Coagulase which converts the fibrinogen into the fibroid. It clots the saturated or oxalated plasma and deposited the fibrin onto the surface of the staphylococci. These are the two basic enzymes. Coagulase test can be performed onto the tubes and to the slide. Other enzymes produced by the staphylococcus includes the hyaluronidase, streptokinase, beta-lactamase, proteinases, or to the lipases. Now we come to us the toxins produced by the Staphylococcus aureus. Different types of toxins it produces, which help these microorganisms for its pathogenicity. Number one is exotoxins, which are of alpha toxins, beta toxin, gamma toxin, and delta toxins. And they also produce the leukocidin, exfoliatin, or toxic shock syndrome toxins, or and enterotoxins. Toxic shock syndrome toxin is a supraantigen with potent inducers of interleukin 1 and cactin tumor necrotic factor. It causes the toxic shock syndrome within the 5 days of onset of menses into the young woman who uses the tampons. Different types of the infections are produced by the Staphylococcus aureus, in which the localized infections, including the furuncles or the hair follicular infection, carbuncles, acne and pimples, and impetigo, and other localized abscesses. It's also produced the bacteremia and disseminated infections due to the drainage of organisms from a focal infections via lymphatic or capillaries to the bloodstream, which causes the pneumonia, osteomyelitis, acute bacterial endocarditis, meningitis, amphibia, or the pyelonephritis. It also produces the scalded skin syndromes or the bullous exoflyton or the pemphigus, caused by the exoflyton toxin. The clinical findings are the large vesicles filled with clear fluids are formed onto the skins, and these vesicles rupture, causing the exfoliations of the skin. These large vessels or bullae filled with the clear fluids are formed onto the skins. When these vesicles rupture, this causes the exfoliation of the skin and cause the serious effects. Toxic shock syndrome caused by the TSST1 occurs within the 5 days of onset of menses into the young woman who uses the tampons. The clinical findings are the abrupt onsets of high fever, vomiting, diarrhea, myalgias, rashes, hypotension with cardiac and renal failure. Here we can see the possible signs and symptoms of toxic shock syndromes. Also, it causes the food poisoning. The enterotoxin produced by the Staphylococcus aureus in carbohydrates or protein foods. The incubation period is 1 to 8 hours, which is short due to the performed toxins. The clinical findings includes the violent nausea, vomiting, diarrhea, rapid convalescence, and no fever. And these cause the serious irritating effects in patients. Now we come to us the diagnostic laboratory test. Various types of these specimens like the surface swabs, pus bloods, and tracheal aspirates or CSFs are taken for its identification. We use the microscopy first of all of the specimens, in which the gram strand smear of specimen is seen under the microscope, and we can see the gram positive cocci in grape-like clusters. After this, we culture the specimens onto the different agars like the nutrient agar, blood agar, and onto the selective media like 7 to 10 बेसिट्रासिन क्रीम एट्सेट्रा। थैंक यू। ये वीडियो पसंद आई हो तो इसको लाइक करना, सब्सक्राइब करना और बेल आइकॉन का बटन दबाना मत भूलिए।